Yeah.
Okay. Good morning, everybody. I'm Dr. Atul Kamath, and I'm representing the topic of mask-related ophthalmological problems. So, the introduction to assess the mask-related problems among eye care professionals and the same among the patients requiring eye care for the same. So, materials and methods. So, among healthcare workers, we did a prospective randomized study of the eye care professionals for 6 months. And among the eye care professionals, what we did was a questionnaire consisting of total 8 hours of wearing masks, number of patients examined in the OPD, and along with difficulty arising with masks was assessed. And based on the assessment, the results were concluded. And among the patients, 350 of them were selected, and out of which a prospective randomized study of eye care among patients was done. A questionnaire again consisting of total hours of wearing mask along with difficulty in arising with the mask was assessed, and based on the assessment, the results were concluded. I've missed the introduction somewhere, so I apologize for that, sir. Yeah. Results. Among the healthcare workers, totally 50 eye care professionals had participated, out of which 10 were optometrists, 40 were ophthalmologists, and among the optometrists, they complained of fogging of trial glasses while doing the visual acuity correction, and among the ophthalmologists, they complained of fogging of the eyepiece objective and the 90-day lens on examination of the patient on slit lamp examination. They also complained of fogging of the operating microscope as well. Again, among the healthcare workers, when we assess for the dry eye syndrome, 10 of the healthcare workers developed dry eye syndrome, out of which 7 developed mild to moderate dry eye syndromes. These were the ophthalmologists. And among the optometrists, 3 developed dry eye syndrome. And total 90% of the healthcare workers developed headache and perspiration during the examination time, and 45 healthcare workers complaints of shortness of breath while examining and doing their work. And the average wearing of mask for the healthcare workers was around 10 to 12 hours. And among patients, 350 patients had participated, out of which the approximate wearing of their mask was 12, 10 and 8 hours respectively. And among 350, 225 were glasses who complained of fogging of their glasses in around 108 patients, which was around 48% of the patients. And among the patients, 80 of them developed mild dry eye disease, 22 or 20% developed moderate, and final 8 or 7% developed severe dry eye disease. Discussion. Study by Rosner et al. Found out that 314 respondents reported of adverse effects from prolonged mask use, like headache being the most common complaint. One more study by Moshirfar et al. Found that mask associated ocular dryness and irritation proved to be consistent in all mask wearers, patients and providers. And study by Crollo et al. Confirmed the existence of mask associated dry eye was more profound in females who had a prior history of dry eye disease, and if wearing a face mask for more than 3 hours had a more significant effect. Conclusion. With mask wearing being a dictum, actually it's because it's been removed by the government right now. So the examination of the patient for an ophthalmologist has become cumbersome. So the ophthalmologist should explain the patient about the potential ocular surface health risk and inadequately fitted masks. And applying dilute solution to the objectives may be beneficial while examining for healthcare workers. My references. Thank you, sir.
Thank you, Dr. Atul.
Thank you.
I had a question. Which type of masks have you considered for the study?
So, ma'am, this was the N95 mask which had become mandatory during the first and
So
second
everybody
lockdown.
was using
N95
N95,
masks.
the valved ones or the
The white ones, ma'am.
valved ones?
Not the valve ones,
Not
ma'am.
the valved ones.
Non-valve ones.
Okay, so everybody was using the same type of
N95
mask.
masks, ma'am. That's what we had included.
Yeah.
So it's missing. Thank you, sir.
And when was this done, in the beginning of pandemic or towards the end of the
From the
pandemic?
first wave to the second wave, sir. In between that, we had done. It was very mandatory to wear masks. After the second wave, gradually the usage of masks came down, sir.
Okay.
Thank you.